So then we have a viewer from Little Falls who wants to talk about mental illness issues and treatment of mental illness issues. And this viewer is wondering perhaps there's going to be some discussion about expanding a state hospital system or otherwise making changes to help with mental illness issues. This viewer points directly to the issue with firearms, but I think the question is more broad than that. Are we likely to see any changes in the system relative to dealing with mental illness issues? Let's start with you, Senator Simonson.
I think mental health issues are a priority for both caucuses, frankly. I think we all recognize this as a serious problem across much of our state, and it's going to be a matter of how we address it. But I think, we're already starting to see bits and pieces of things in different omnibus bills that are starting to address the problem. But our HHS budget is not out yet, and I don't sit on that committee, so I don't know exactly what's in it. But I do think that this is an absolutely high priority for both caucuses as we go forward.
And I think this is definitely not a partisan issue. I think that we're going to see some movement on that. Right now, right now we have issues with people going to a high-level facility and not being able to move and start stepping down. I think that's primarily the bigger problems is once you get people into an inpatient setting and they're stabilized, what do you do with them next? Because ideally what you need to do is have a flow through that system as opposed to a roadblock with people hitting one spot and just sucking up all the bed space until something happens. The person is actually sort of right. It does have a little connectivity into guns. That I think that if people are mentally ill, the best thing we can do is get them into facilities, and it benefits us from a public safety perspective. Not having people on the streets that might get into trouble and might be a threat to society. So I think spending, I've never had a problem spending on mental health issues. It's something from a societal point is beneficial in so many different ways.